Inner Voice, a heartfelt chat with Dr. Foojan.
To just implement in their brain. And a lot of people that come to me, they come in because their kids have been diagnosed, or through social media, they have been seeing other people who have been diagnosed, and they're saying, wait a minute, but I do that, or I do that, or I do that. Just like you were saying, that people who are like, well, I have a hard time paying attention, that I've got ADD. For me, the people who come to me are the ones who are saying, oh, I do a lot of things that my kids do, but I've never been diagnosed. I'd like to look further into this. Is this something that I might have genetically? And because neurodivergence is a dominant trait within our genetics. So if our kids have it, chances are wonderful.
Introducing a powerful new update from the Foojan app. Now with flexible subscription plans to fit your journey monthly, quarterly, or yearly. Our new AI-driven onboarding customizes your path to feeling better, faster, and enjoy a refreshed experience with stunning 3D interactive videos. Update now. Empower your inner voice with Foojan. Download today.
Welcome to the Inner Voice, a heartfelt podcast. I'm your host, Dr. Foojan Zeine, a psychotherapist and author and the creator of the Awareness Integration Theory. So thrilled to have you join us today. And I promise you, it's a very interesting and insightful conversation and a discussion with Dr. Kristen Williamson. She's a licensed professional counselor with over a decade of experience. She specializes in helping neurodivergent adults, particularly those diagnosed with ADHD and autism later in life, navigate challenges related to personal growth, professional development, and emotional well-being. As the founder of Empower Mind Solutions, LLC, she works with individuals to embrace their unique traits, build resilience, and develop practical tools for success. She's passionate about destigmatizing neurodivergence and empowering people to thrive by harnessing their strengths and not focusing on a perceived deficit. In addition to her clinical work, she's an advocate for neurodivergent communities and an active speaker sharing insights on how to create more inclusive, supportive environments in both personal and professional settings. I had an amazing conversation. It's a blast, and I learned a lot and a lot of insights as we were talking about this, since she had been diagnosed with ADHD and autism at a later age of 38 and 39, and her whole family, her husband, her children. So not only she has a lived experience and living experience through it every day, and being very, very successful in both professional realm and family and personal realm, but also is a therapist and who works with the adults who are diagnosed. So I'm positive that you will have an amazing learning and experience when you hear our dialogue together. Now, be sure to subscribe to my podcast and YouTube channel, and connect with me through my website, foojanzeine.com, or social media. Sure to go get the Foojan app and go through it with 31 areas of your life and go through the concept of the awareness integration theory and see we're getting people who say about 70 to 75% improvement in that area of life. And that's awesome. And then Mira, which is the chatbot assistant, your personal coach that is brain trained on AIT, and she's there for you to ask questions and will respond from the perspective of the theory and give you answers and skills and all of those. So without further ado, I'd love for you to hear Dr. Kristen Williamson.
Listen up if you want to promote your personal growth and self-awareness. I found the Foojan app last month and I have been absolutely loving it. I personally have never learned guided meditation, but thanks to this app, I now have learned incredible tools for my own stress relief and emotional self-awareness. Not to mention, there are self-evaluation tools and professional coaching available to utilize however your journey to self-discovery takes you. Join Foojan today and redefine your life one step at a time.
Intentional Parenting, a practical guide to awareness integration theory
Written by Dr. Jafari, Dr. Foojan, Zeine, and Dr. Manoukian, 3 experts in human development, is your step-by-step guide to raising a healthy child prepared for a culturally integrated world. You're supported in parenting infants to adolescents using the latest evidence-based scientific research on parenting. Order your copy on Amazon now. Well, I'm so excited to have Dr. Kristen Williamson with us. Welcome to the show.
Thank you so much for having me. I'm so excited to be here.
Same here. We're going to be talking about a topic which I have been hearing, working with, and for the past, God knows, 20 years. But I think more, I've worked more with the parents of children who have been in some sort of the spectrum of the neurodivergent, whether it was been attention deficit hyperactivity disorder or in some form of an autism spectrum. And I know that the range and the differences between all of it is so much. And, there's a stereotype that we think about. And then there is also, the range and the spectrum that is. And I think every day we're finding more and more, because I think we're more cautious a bit of it. We know how to diagnose it better. There's more of that. But then there's on the side, which right before you and I came on to the show, I was working with my therapist and interns and all of that. And you also have the other side of it, which people are just self-diagnosing back and forth without necessarily having it to be accurate, right? Like if they can't pay attention to something, it was just, I'm just ADD. Or so there are a lot of people who are also self-diagnosing and taking it on. Oh my God, I can't really look at you in the eye, so I must be autistic. So all of that. So you go from one spectrum of just people normalizing however it is for themselves, all the way to the other side, which people hold stigma. They don't want to take their children to be tested because they don't want a record. There's just, and they're not watching for what might not be working and not getting the treatment that they need. I know that was a lot I just put on the table, and now give it to you, sharing with me all that your experiences.
I love that you already noticed that the pendulum can swing wildly in both directions. I work with clients who are 18 and above, and I have just very luckily been able to come into this niche of people who are neurodivergent. I call them neurospicy because I wholeheartely believe we have the spice of life. Whether that's an intense spice or not, we've got it. And so, but I really like saying neurospicy, so you'll hear me say that more often because it's just kind of looped in my brain of a fun phrase to say because it reduces the stigma. It takes away the shame narrative that so many of my adults have come to just implement in their brain. And a lot of people that come to me, they come in because their kids have been diagnosed, or through social media, they have been seeing other people who have been diagnosed, and they're saying, wait a minute, but I do that, or I do that, or I do that. Just like you were saying, that people who are like, well, I have a hard time paying attention, that I've got ADD. For me, the people who come to me are the ones who are saying, oh, I do a lot of things that my kids do, but I've never been diagnosed. I'd like to look further into this. Is this something that I might have genetically? And because neurodivergence is a dominant trait within our genetics. So if our kids have it, chances are one or both parents have it. And then you look in that genetic train line of like, okay, how many can we look back and do to say, yeah, that's pretty normal and it's okay. There's nothing wrong with it. And the gloriousness that I am seeing these days is people just coming in with less shame, with less guilt, and more of the, you know what, I do have a hard time making eye contact. I don't need to make eye contact. Or I can tell people this is a little bit harder for me to do. So if you see me looking off, it's not because I'm being rude. And so not even people coming in with their, yep, I'm neurodivergent. They're just coming in already looking for ways that they can build accommodations into their life So that way they're not struggling continuously, even if that it never gets them to a diagnosis. Because a lot of people, like with autism in adults, there's not medication for that. There's not a whole bunch of things that a true diagnosis can do, as opposed to an ADHD diagnosis. Because there's still things that medication can help with the how fast your brain is going to kind of slow it down or give it a laser level focus. But I think just coming in and getting that understanding of, okay, well, my brain is divergent in that I struggle with sensory and an auditory version that's a little bit higher. So I'm going to carry earplugs with me. I'm going to do this, or I'm going to do this. And they're just allowing themselves the grace that they hadn't given before.
My understanding was also, but you correct me, that when a child has been diagnosed in the spectrum of autism and they do behavioral therapy and social level kind of therapy, like behavioral therapy, but also the skills that they're taught about reading the social cues and how to be, even if it's an act at the beginning, that it does shape the neuroplasticity of their brain. So there is something we could still do with someone who's been diagnosed with autism, and not really look at it as that's it. Like,
no, absolutely. With adults versus kiddos, I think there's an entirely different thing. With kiddos getting diagnosed, they do have that ability to come in and get different levels of therapy, different levels of assistance. Within the schools, they can come in and get IEPs or 501Cs. I'm going to get that mistaken because I don't always know the words for the kiddos because I don't inherently work with kids, but they're able to get levels of accommodations in school. That's not saying my behavior is allowed, but it's, this is where I struggle with. Here's some things that I can do that can help me. Yeah. Here's some things the teachers can do with, I have a 15-year-old who got diagnosed when he was 8 with ADHD and with autism spectrum, level 1, although at that time when he was diagnosed, I believe it was even still on the Asperger's level. But now they've since moved it into 1, 2, and 3, and just levels of support needs on a day-to-day basis. And so he's one of the ones that's lower support needs. But we learned, and I was able to tell this to his teachers, if you say the words that's inappropriate, like that was his keyword of, okay, I'm not doing something that my brain thinks is, or I'm doing something my brain thinks is okay, but it's not okay. And so I was able to come in and give teachers that pathway to say, no, that's not appropriate. That's inappropriate. That's not okay. And his brain knew that. But I was able to come in as a parent to say, okay, my kid has been diagnosed with this. This opened up so many different lines of what can I learn? How can I help him? How can I help him to then help the teachers? Because I didn't ever want to be that parent that just says, well, you know, he's on the spectrum. You just have to accept him as he is. And I think there's a glorious level to that, but also one where it says, no, let's work on the socio-emotional component. Let's learn where you struggle or where, hey, you said this is not an appropriate thing to say. Let's add in tact. Let's add in this and things that he wouldn't necessarily know. But we also went through plethoras of therapies that the therapies he went through was so life-changing because it took some of his maladaptive behaviors and it helped to remove those, but to replace them with things with different levels of stemming that wouldn't ever come in to self-harm, but could be to where he would start snapping instead, or he could do other things. So it didn't remove the stemming, but it removed the levels in which he might hurt himself.
And my understanding is also that when, you know, a person who is in the spectrum of neurodivergent sometimes is different from other kids which learn by just watching and implementing and role modeling and role playing and taking it in. Like there's an introjection that we do as human beings. Like we look at outside, we look at things and then we take it in automatically and do it ourselves, and especially in the realm of socialization. Mm-hmm. Because this kind of not getting the social cues, not having the understanding of, oh, that's the way it should be done, or the abstract level of, oh, they said this and it's a sarcasm and it's a ha-ha around it, or this is a way that we could connect to each other, even if it feels like you're bullying me, but you're kind of doing it in a way that you're being funny, so you want to connect with me, but you don't get that,
Mhm.
So
No.
a lot of times these social skills that are built as we kind of go along and learn and, do a trial and error until we figure out our own and how to bring those social skills within ourselves. Because someone who's in this spectrum doesn't have the same ability, they don't catch on those skills. So sometimes in the one-on-one therapy, those skills have to be specifically taught to them as something they need, because on a normal level, they just wouldn't be picked up.
One of the things I really like with the therapy, especially therapy when you're younger, is kind of like that group social skills, and they can get together. I knew a therapist a couple years ago where every summer she would have a teenager social skills group where they would play board games, and they would have it as like the games where everyone was playing against a monster or against something. So they weren't pitting one another against each other. So they had to learn how to work together and how to talk to one another. But they did it in a game-based activity in ways that there was still a therapist putting it together so she could step back and say, okay, but did you see how this person, her face wasn't a frown? So do you think she might be struggling with this? Do you think she's happy? And so it's a way to kind of teach those skills in a safer therapeutic atmosphere. Because, you are right on the money that I still miss a lot of, if someone says something, I'm like, I missed the joke. I don't get it. But I've learned that I can say, I don't get it. And all of my friends and family are they now giggle because they know it's something I don't get. And I'm happy to say, no, I totally missed that joke. If it's said on a surface level, I'm going to hear it at a surface level. I'm not going to look at the underlying assumptions. But it's also something that I have been able to learn about myself, to say, if there's something underlying, there's a 40% chance I'm going to miss it. And that's actually another side component of it, is the gendered nuances. Females, and I say this very, very much as within the United States, we are culturally almost from the womb learning these social components. And okay, well, we can't be too loud. We need to smile. We need to make eye contact. We need to do this or this or this. And so for the neurodivergents, it's a level of masking that has been built on almost since birth. And as they are coming into themselves, even though they have this, like the social rules of, okay, well, I need to do this or I need to do this, that means that they are pushing down their behaviors with maybe fidgeting or moving around or what their stimming looks like. And so it's a constant exhausting component of, I need to make eye contact and now I need to look away. Did I make it weird? They're talking about this, the pragmatic speech of, he said hi, I need to say hi. I can't just talk about cats. I need to ask questions. And so that bouncing back and forth of the conversational tone, that when they get home, they fall apart. ADHD kids, they're holding in all of their bouncing around behaviors for so long that when they get home, they just fall apart. Parents will say, oh my gosh, well, my kid came home and was just the biggest butthole to me. It's like, well, yeah, they've been holding in all of these natural behaviors that they can't explore, they can't do well in a school thing. So when they get home in their safe space, this is how they're doing it. This is what they're doing. And then my females, when they get into adulthood and they work through heavy levels of burnout and that they have been masking for their whole life. And that can cause a lot of physical health ailments, mental health components. A lot of my females were diagnosed with anxiety or depression before they were diagnosed with autism. That's just, doctors immediately jump to, here's this, here's this. versus, well, where's this anxiety manifesting from?
You share also about the concept of how to, we identify as a diagnosis suddenly because, we feel different than others, different than others. And then the world will tell us we're different. And they're not telling us we're different, wow, different. They're telling us we're different, like, that's different. So the level of like self-esteem and self-confidence kind of goes down. We'll create our own coping mechanism around it. So can you share a little bit about how to, how to come into a self-acceptance and self-compassion? Any other condition that we have, because this is a condition that is going to be here to stay. This is not a condition. It's not a temporary concept, right?
You are right on the money with that. It's been around for as long as we can remember. It just hasn't been anything that was ever necessarily a diagnosis. Einstein, we believe, was on the spectrum, but he wasn't diagnosed with anything. He was just ridiculously smart. There are books written about Thomas Jefferson, like with him being on the spectrum and his hyperfixations, but he still made president. And so on a side note, for me, it's so cool that you can have this diagnosis and still do amazing things. It doesn't mean you're broken. It doesn't mean you're flawed. It just means that you're different. But what I have found is that some people, for the self-acceptance, people around you are going to put you in boxes that they are understanding and that they are comfortable with. So someone can look at me and be like, oh, you make me uncomfortable. I'm going to put you in this box. I'm going to put you in this label. Okay, well, that's that person's right. They can put me in that box, but that doesn't mean that I have to take it and stay in that box. I can say, look at this box. I'm going to add windows. I'm going to make it glittery. I'm going to turn it pink. And it's actually, this is where I love my people who can come in to even get this understanding of, I work different, but that doesn't mean that I'm less, because then they are able to add in that acceptance. They are able to add in these accommodations for themselves to say, I love going to concerts, but then when I get home, I struggle with really high anxiety. So it's like, you know what? Let me kind of measure where my stress is at, that I can go to this concert, but maybe I need to leave an hour earlier. Maybe I need to leave before other people do, because leaving when everyone else is driving makes me feel really stressed out. And so they can just start building in these little coins they can put into their piggy bank of self-esteem to build up into, no, I can do this and this is okay. I'm actually really strong in this area of life. Look at this pattern recognition that I have, where I might be able to crochet an entire blanket filled with these cool designs that other people might not get to do because their brains don't work as quickly as mine does for the crocheting component, or for working in something computer related. And as people are learning that they might interact socially different with people, there's still going to be others who love you just as you are, and that's okay. And then there's going to be people who say, oh, you're a little odd. You say, yeah, isn't that amazing? And just coming in and saying, yeah, I'm a little odd. That's okay, though. I can walk backwards down the street where other people say, no, you're not allowed to do that. Yes, I am. And it's neurotypicals. Their brains are like, you can hear rules and say, okay, that's a social norm. Like, we walk forwards. Where my neurospicers are like, I'm going backwards. This is so much fun. Isn't this awesome? I've learned this within the work culture. Neurospices have a harder time with hierarchy. Like, we'll go talk to the CEO. That's okay. They're just a human. They're allowed to be told hi. You're allowed to do this or this, where other people are like, clutching my pearls. No, you can't talk to them. They're the CEO. And it's like, but they have to put on pants just like me. And so that's my long-winded approach for saying it's, you find where you are quirky and you say, yeah, I'm kind of quirky, but that's okay. There's nothing wrong with this. You might have a harder time showering or washing your hair or brushing your teeth, but that doesn't mean that you're not doing it. It just means that it takes a little bit longer. but you might be spectacular at reciting pi to the nth degree.
So you can look at what is it that you're good at and what you're natural at best. Sometimes you're just not natural at best. And, you know, for those, you can either train yourself to do it or accept that you can't. Or it's not even important enough for me to put a lot of emphasis on this to do it. Since other people are doing it, it doesn't mean that it has to be a priority for me. But for that also takes a different level of acceptance. And I think that, you know, it's knowing that I didn't have a choice about having this condition, but I can have a choice about how I want to deal with this condition.
That is so beautifully put. And I think we can actually attach that to most things in life. I can think of people who have been diagnosed with diabetes. It's okay, I didn't have a choice for this, especially the type 1 or childhood diabetes. And okay, I didn't have a choice, but I'm going to choose how I'm going to live my life. I'm going to choose my mindset with this. Dr. Viktor Frankl was a psychoanalyst in the 1940s, and he wrote a book called Man's Search for Meaning. And what I love about that book is it talks about one of the last freedoms we have as humans is our freedom to decide how we're going to respond to something. And so we can come in and say, you know what? I don't have the easiest time talking to people, but that doesn't mean I'm not going to try. That doesn't mean that there aren't people who won't hear me or say, oh, I really like what you have to say. This is super interesting. And I think it's learning that, yes, you might have trouble with this, but one, you can keep practicing, you can keep doing. It might never get easier, but it gets less anxiety inducing in your brain. There's a type of therapy called exposure therapy, and it's I'm going to do something small over and over and over until it becomes mundane, and then I'm going to step it up. And I'm going to do that over and over and over and just get exposed to it. So for me doing podcasts in the beginning was so anxiety inducing because it's getting to talk about myself or to talk about things that as a therapist, I'm used to being the one listening. I'm not used to being the one talking as much, but it's doing over and over and over until it becomes, you know what? Okay, if I say something funky, well, I said something funky, but it's going to make a good story later on.
What has been your own experience growing up?
You know, I didn't get diagnosed with autism until I was 39. I didn't get diagnosed with ADHD until I was 38. And so I grew up in a military household where we moved a lot, and a lot of military families tend to get missed because once the mask starts slipping, they move to a new place. So a lot of teachers don't get to see this. A lot of doctors don't get to see the same thing. So they don't get diagnosed until later on in life, if ever. But once I was diagnosed, it was the coolest thing in the world because I could look back and say, oh my gosh, that I was sure enough a little weirdo, but that's okay because it wasn't that I was trying to be off or quirky. That's just how it came out. And I did not like wearing blue jeans ever. It was a texture and a sensory issue that I was, but that didn't mean that there was anything wrong with me. There was nothing wrong with blue jeans. We just didn't connect. And so getting diagnosed, it just lit this light bulb that I could go back and rewrite that narrative. But in the beginning, while growing up, it was hard because it felt as though I almost kind of felt like an alien wearing a camouflage of a human. And okay, I'm going to study these girls' behaviors. Oh, when I was growing up, Friends was big. And so I would watch the TV show and stuff like that would get laughs. That would get laughs. Oh, look, she raised her eyebrow like this, and study their facial features and try to mimic that because in my mind, like that's what people did. And so I would just come in. And so the mimicry was very high. And even still to this day, I have scripts in my brain that I can utilize on a day-to-day basis. And I almost think of it as my brain is a giant row of filing cabinets and like, okay, well, we're going to talk about autism. Let me pull out these scripts. I know what to say. I know what to do. But sometimes if someone will ask something that I am absolutely unprepared for, it's like my brain starts buffering because I'm trying to find the words to say because I don't have them pre-written and ready. So as a kid, it would be, okay, well, you're going to go talk to these friends. What might they say? How would you respond? Well, what if they say this? Well, how am I going to respond to this? Or phone calls, I would practice it ahead of time. I think even to this day, I still kind of practice phone calls ahead of time, but I know calling to set up an appointment, there's going to be a specific script that goes in. Calling to talk to a friend, specifically, if I know this friend, I know kind of what we're going to talk about. So that makes it easier. It reduces that anticipatory anxiety that comes in.
But I think that there's a part that everyone kind of does that, but the difference that I sense from you is as we're growing up when we're doing this, then we integrated something inside that this is who I am. And correct me if I'm not accurately hearing you, is that you didn't experience that integration to say, this is me. There was always a me that was different than all of these skills.
That you are right on the money with it. And I think of it now because with masking, I can kind of think of it as there's different components. There's masking and camouflaging and assimilation. With assimilation, it is, nope, I'm thinking about camouflaging. I can put on the chameleon suit of, I'm going to go talk to these people about sports. Or this set group of moms, because my daughter's in drill team. We're going to go talk. This is the mom talk for drill team. And I have to almost flip my chameleon skin colors. And these are the scripts to talk about with them. These are the scripts to talk about with them. It took me into closer to the age that I am now. If not, it's still an everyday learning of who am I versus what chameleon coloring am I wearing, because I can change and assimilate into so many different scenarios, but it doesn't feel inherently me. It feels as though it's the mask I'm wearing.
In another realm, again, I hear this and I'm like, okay, but don't we all do that? It's just that we do it so automatically that we think it's a me versus it's just been so automatic that I can link these boxes together. And possibly what I'm hearing from you is that the linking of the boxes are not together to have this kind of a personal sense into it, that there's always this separation that, okay, that this response is to whatever shows up out there, and this response is there. And that's possibly why, if the linking is not there, that the undertone conversations are not understood because it has to be so literal. Like this response it's like a computer coding that this,
yes,
if and then only is applied to this concept. So the coding hasn't written in order for it to be then integrated. So the integration part of coding is not there.
And you are absolutely correct. I can talk about my upbringing as a neurodivergent, but in neurotypical's upbringing, you're right. We're still like in middle school, we're all studying one another. We all feel awkward and weird and out of place.
I call that era the worst of humanity. Like
so much middle school girls, they have a level of venom. Oh, I know. I've got a 12-year-old. She is vicious sometimes.
Yeah, I think this concept of superiority, inferiority that shows up right at that age just brings the beast in us. Like we can really, really be harmful. And then we tone it down as some of us tone it down as we grow up. And some of us, I guess, had too much fun with bullying that we never tone it down and we use it. But that is the worst part of humanity, as I call it.
There is a study that came out in 2014 that has lived rent-free in my brain for such a long time. Whenever we're born with like millions of synapses in our brain that help to have us learn everything in life. and just how we process things. And as we hit childhood and adolescence, these synapses start getting pruned because it's like, that's not necessary. We don't need to go through that. They've learned that in neurotypical brains, about 50% of these synapses are pruned or removed. In a neurodivergent brain, 16%. So I think of it as a rose that has all these beautiful leaves. As neurotypicals go on, they're clipping these leaves, they're pruning them because we don't need that much. But neurodivergent, we still have rows and rows and rows of leaves that as we are processing things, we go through every vein, we go through every channel, which takes it longer to process maybe some auditory information or sensory through tactile or other sensory issues. And it takes a little bit longer for us to process, which I remember Dr. Devin Price wrote in, I believe in the book Unmasking Autism, they talked about neurotypicals and neurodivergence. Whenever we mature, whenever our judgment part of our brain develops, neurotypicals, it develops around 25, 26, but neurodivergence, it takes a solid 7 to 10 years later. But once we are in our mid-30s, we tend to be on the same wavelength as everybody else. It just takes a little bit longer to get there.
And it has it keeps all the synapses.
Hmm?
Your brain is fuller than everybody else.
Oh, it goes through so many different channels. And that's why it takes longer to do a lot of things. And I think that's what you talked about earlier with, what can we do for the acceptance? It's it might take me longer to do things, but I'm going to get there. And it's okay if I go about it in a different way. I'm still getting there.
And what would you say to parents?
What would I say to parents? I would say it's okay to have your kids get diagnosed. There's nothing wrong with it. If they are struggling with something, it's okay to talk to someone. It's okay to find support groups for yourself. It's okay to find other parents who have kids that might have the same brain as your kids. And then you get in that level of just parent acceptance because, when my kiddo, before he was diagnosed at 8, we had a lot of meltdowns in grocery stores and I had no idea it was because he was struggling with sensory issues. But I would look around me and all these people would look at me and oh, well, she must be the worst mom ever. And just that shame of, I can't believe I'm failing my kid. How are other people doing this so easily? What am I doing wrong? But then getting into that group of other parents who are oh yeah, no, let him have that moment. It's okay. You're not doing anything wrong. And then it was what? Oh, this feels so nice to have people just accept him and accept me as we are. This is just glorious. But also having kids who are neurodivergent, it's hard. It is hard. It's not easy in any way, shape, or form. When you start working with their brain versus against them, I think that opens up pathways that can make life easier. But there is still going to be learning coming in every day. And I don't think there's anything wrong with that. It's just coming in saying, okay, well, what have I missed this time? Or has something changed? Because, puberty comes in and then everything takes a whole different level. Again, middle school. And it's, as a parent, come in with curiosity versus judgment.
Now you have a double whammy. You got the best of both worlds.
I do.
Yes. So you got first diagnosed with ADHD and then autism.
Mm-hmm.
How do you see each one of them appear for you? And I know some people that might hear me are are you crazy? But each one of them have some benefits. And how would you kind of look at how the ADHD has created and flourished your life and hindered it, right? So in some level flourished it and some level hindered it. And how has the autism done the same? And is there a difference? And can you see the difference between the two in a sense?
Oh, I can. I very much can. I think of it with walking. For me, I step forward first with autism and ADHD shows up second.
Oh.
For my husband, ADHD shows up first, autism shows up second. And so it is glorious and horrifying at the same time. For me, I present first and foremost with rigidity. And I see this, like the cognitive rigidity. If something is different, I have a harder time coming to terms with that. I like things organized. I like things set up in a specific way. I like that all my plates are circular. And so that chaotic man bought me a square plate and put it there just to see. I'm like, no, I can't have a square plate next to my circle plates because my brain says that's not okay. In reality, it's a plate. It's fine. But it took me a longer time to process this. I was going through all the leaf channels to say, no, okay, it's a plate. It's allowed to be there. But with that, I do so well with organizing and with setting up. And I love me a good list. I can set up an Excel spreadsheet like nobody's business. I can do all these different things with the autism and the ADHD that both comes with kind of levels of hyperfixation. And the hyperfixation with motivation, typically we will see with humans, we are either internally or externally motivated. Neurodivergent brains are interest-driven motivation. And my interest tends to be neurodiversity. And so I know more about it than a lot of other people because it's fun for me to learn about. I get such levels of joy that I've not ever expected, that other people are like, why are you reading these research studies? This is amazing. I love learning about our brain. Can I go get a picture of my brain? And people are like, what? I'm like, yeah, that's my Tuesday. But that also comes in with the ADHD I see with object permanence. And sometimes my cabinet doors get left open because I need to see what's in there. If it's closed, for me, it's out of sight, out of mind. And that actually comes in a lot with, if I haven't talked to friends for a while, I won't instinctively know to message them because I'm just like, they're out of sight, out of mind, but never forgotten. The level of friendship does never change. It's just that level of connection. My people in my life know that whenever we talk, it'll be a phenomenal conversation, but it may not be something that I will initiate all the time. And that is a blessing and a curse at the same time. And it's things that you have to kind of pull up into your head. For me with parenting, I have a very hard time with touch. I have to remind myself or check in. Have you hugged your kids today? Have you done this? Where other people, that's just kind of in my brain, I think that's kind of an instinctual thing. Oh my gosh, I'm just going to touch my kids. I'm going to love on them. I'm going to do all this. But for me, it's very hard. And I have to make active steps to do it because I know touch is a fundamental part of their upbringing. It's just not something that comes in easily to say, oh yeah, no, we can do this. That's fine.
So you have both diagnoses. Your husband has both diagnoses and your children have both diagnoses?
My son, my 15-year-old, has both diagnoses. My daughter has just ADHD. So she just comes in with that bouncing off the walls. I think she probably has both diagnoses. But for girls and for women, there's not assessments that are made for females. There is the autism assessments were originally created on white middle class males and boys. And so that really did a disservice to my females and to people of color, because if they don't hit that very specific criteria, they wouldn't get diagnosed. And now, as you were talking about right in the beginning, that people are getting diagnosed more, that the criteria is expanding. It's because we're able to see, you know what, just because girls are masking, that doesn't mean that they still don't have trouble hugging their kids, or with others that they have trouble showering or other activities of daily living, because it just takes so many more tasks to complete. And their brains are very almost computer coded with tasks. Here, I can do this and this and this and this. But showering might take 17 tasks versus washing my hair in the sink, which will take 2.
Do you experience also rumination as part of either or of the diagnosis? I know ADHD definitely has some rumination.
I did for a very long time. I think before I really started embracing my brain and saying like, okay, it's different. But in the rumination, I will pre-plan the conversations. Like for this podcast, my brain practiced it over and over and over prior to coming in.
Are we close to what you did?
Oh yeah.
Okay.
And I love that you ask me questions that I'm not prepared for, because it gives me the ability to come in and expand for any other podcasts I do in the future to say, okay, now let me add this to my filing cabinet.
So it's interesting. What you just said is so interesting, because in my world, you and I are having, it's just like a surprising going a flow of whatever shows up, right? So in my world, this conversation is emerging. It's not, I had no idea what I was going to say to you. I just sit here and allow for it to show up. And then I listen to you very carefully. And then I allow it to show up for me, whatever the next question or the next topic is. And it is spectacular to hear that right on the other side, the experience is, this is all scripted. I'm sitting like, how was this scripted? I didn't even know what I was going to say. But in your world, you're like, girl, I had all of this scripted. All I did, I just went into different boxes and brought them out and brought, and then whatever it was a surprise, guess what? It's going to be another box that I'm just going to add to it. That is absolutely fantastic.
It's so much fun. And I think what I really like about doing this is because this is something that I enjoy doing. This is a conversation I love having. So my well of knowledge is deeper with neurodiversity than it would be talking about creating a house. And so I could talk very surface level about that, but this, in the questions that you ask, it's in some realm of information that I have that I can also say, oh, let me pull up this information, or let me talk about this author or this.
But and the same, you and I at this point, I just want to share this with you, are doing exactly the same thing. But I'm under the delusion that there's a part of me that is just going into it and it's so like, it's just doing. So I don't have this, there is an I that is separated than the box. I have this delusion that me and all the boxes are the same. We're just like, it's a reference point. And when you describe it, is as if there is an I, there's a Kristen there, and there's our boxes. The experience is interesting.
It's so much fun. I love even talking with you, because I didn't even know you were coming in saying like, oh, this is just kind of evolving as we're going. And I love brains. They're so incredible in that we can connect and do things very similarly, but have such different experiences from them.
Yes. I mean, I hope that, this audience or, or the viewers or the ones who are listening to us that really capture that. It just seems like two gals talking. And then yet in my world, it's me and all that is all there just shows up, right? Because it's such an effortless concept. Like, but for me, it's just effortless, right? It just shows up. And then for you, it's more like, no, there is a person in there that has to make the effort of going and unlocking this box, getting the information out and coming out and presenting it. And so the experience internally is so different, although externally, it's just like the two of us shooting the breeze.
It's so funny. I am, for it to look as we are two gals effortlessly talking, mine is the practiced effortlessness. And it makes me think of the movie Inside Out, that there's all these different characters in the brain. And I can think of like, okay, have you smiled yet? Let me hit the button that says, now you need to smile. Now you need to do this. And it's like, let's make this look effortless.
Yeah. You're the behind the scene. You're looking at the behind the scene. I love this. Kristen, anything we haven't said that you really want people to know?
One of my favorite things to kind of sum up with is anyone who is neurodivergent or not neurodivergent, but you feel as though you are different than other people. One of the biggest takeaways is to know that just because you might be different doesn't mean you're less. And it's not ever your job to dim your light to make sure others shine.
Yes. Yes, absolutely. Where could people find you?
I am on all kinds of social media. I tried to post videos daily, and you can find all of my social media connections at my website, which is empowermindsolutions.com.
All right. Well, it was a joy to have you. Dr. Kristen Williamson, everyone. It was really a joy to have this conversation and have these openings with you.
This has been so much fun. Thank you so much.
Of course. And for all of you who are out there, create an amazing life for yourself and everyone around you. And until next week, bye-bye.
Are you a psychotherapist looking to enhance your practice? The Awareness Integration Therapy, developed by Dr. Foojan Zeine, is a comprehensive guide to the principle and techniques of this powerful therapeutic approach. Join the growing community who have elevated their practice and expanded their skills by embracing Awareness Integration Therapy and witnessing its life-changing impact. Order your copy on Amazon now.